Snoring. Snoring is a common condition in which the tissues at the back of the throat vibrate while a person is breathing during sleep. The vibration is caused by a narrowing of the airway, which can be due to various factors such as relaxed muscles, excess weight, or nasal congestion. Snoring can be loud and disruptive, and it may also be a sign of an underlying health condition such as sleep apnea. While snoring is often harmless, it can disrupt the quality of sleep for both the snorer and their partner, and may require medical intervention if it is severe or accompanied by other symptoms. Snoring causes. Snoring can be caused by a variety of factors, including age. As we get older, our throat muscles tend to become weaker and more prone to collapse during sleep, leading to snoring. Obesity. Excess weight around the neck can put pressure on the airway, narrowing it and making it more likely to vibrate during breathing. Alcohol and sedative use. These substances relax the throat muscles, making it easier for them to collapse and cause snoring. Nasal congestion. Anything that blocks the nasal passages, such as allergies or a cold, can force you to breathe through your mouth, leading to snoring. Sleep position. Sleeping on your back can cause your tongue and soft palate to collapse to the back of your throat, leading to snoring. Smoking. Smoking can cause inflammation and swelling in the throat, making it more likely to vibrate during breathing. Genetics. Some people are simply more prone to snoring due to genetic factors. Medical conditions. Certain medical conditions, such as sleep apnea, can cause snoring as a symptom. Snoring diagnosis and treatment. Diagnosis. To diagnose snoring, a doctor will typically perform a physical examination and may ask about the patient's medical history and sleep habits. In some cases, the doctor may recommend a sleep study to help determine the severity of the snoring and whether it is related to a more serious condition such as sleep apnea. Treatment. The treatment of snoring depends on its underlying cause. Some common approaches to treating snoring include lifestyle changes. Losing weight, avoiding alcohol and sedatives before bed, and changing sleep positions can all help reduce snoring. Nasal decongestants. If snoring is caused by nasal congestion, decongestants or nasal strips may help open up the airway. Continuous positive airway pressure or CPAP machine. If snoring is related to sleep apnea, a CPAP machine may be used to keep the airway open during sleep. Surgery. In some cases, surgery may be recommended to remove excess tissue in the throat or to correct structural abnormalities that contribute to snoring. Oral appliances. These are custom-fitted devices that can be worn in the mouth during sleep to help reposition the jaw and tongue and keep the airway open. Not all treatments are effective for all people, and that it may take some trial and error to find the right approach to treating snoring. It's always best to consult with a healthcare professional to determine the best course of treatment. Home remedies to stop snoring. There are several home remedies that may help reduce or stop snoring. Some of these remedies include weight loss. Losing weight can help reduce excess fatty tissue around the neck, which can narrow the airway and lead to snoring. Change sleep position. Sleeping on your side instead of your back can help reduce snoring. Elevate the head. Using a pillow to elevate the head can help reduce the amount of tissue that vibrates during breathing. Avoid alcohol and sedatives. Alcohol and sedatives can relax the muscles in the throat, leading to snoring. Treat nasal congestion. Using saline nasal sprays or nasal strips can help open up the nasal passages, reducing the likelihood of breathing through the mouth and snoring. Practice good sleep hygiene. Getting enough sleep and maintaining a regular sleep schedule can help reduce the likelihood of snoring. Exercise regularly. Regular exercise can help strengthen the muscles in the throat and improve breathing. Try throat exercises. Certain exercises, such as singing or playing a wind instrument, can help strengthen the muscles in the throat and reduce snoring. Note that not all home remedies will work for everyone, and that snoring can sometimes be a sign of an underlying condition that requires medical attention. If snoring persists despite these home remedies, it's important to consult with your doctor. Snoring complications. While snoring is often harmless, it can be a sign of an underlying condition such as sleep apnea, which can lead to complications if left untreated. Some potential complications of untreated sleep apnea include high blood pressure, cardiovascular disease, diabetes, daytime fatigue, depression and anxiety. Seek medical attention if snoring is accompanied by other symptoms such as excessive daytime sleepiness, pauses in breathing during sleep, or gasping for breath during sleep. Your doctor can help diagnose any underlying conditions and recommend appropriate treatment.